Hair transplant, I think, has a really bad rap because people think of the old techniques where we use punch grafts. And so it looked like doll's hair, and it did not look normal. It didn't look natural. It did move hair where you want it, but it really didn't look natural. Now we do something called micrografting, where we would literally take a single hair follicle, which may have 1, 2, or 3 hairs, and we transplant that. We typically transplant hairs from the back of the head where there's many, many extra follicles, and we put them where you need them, which in men is typically a bald spot or the hairline, and in women it can be the hairline or areas where there's just recessed hair or thinning hair. It's very, very effective. It lasts forever. It looks totally natural, and it's a procedure that can be done in the office. The one we use in the office is called NeoGraft, which is one of the newer technologies and most innovative ways of transferring hair. Is NeoGraft a one-time procedure and then you're done, or is it multiple visits? Typically NeoGraft is permanent, and so a one-time procedure would be all that would be needed. The only time when we do NeoGraft again is if a patient continues to lose hair. The grafted hair will not be lost. It will stay forever. But if they continue to bald in other areas and want to fill in those areas, then we might do another treatment. Is NeoGraft an affordable treatment? It is expensive, but it is permanent. So that always makes me think that it's really not as expensive. I mean, if you use Rogaine and take finasteride, which are medications which can improve hair growth, those over a lifetime could be quite expensive. A typical NeoGraft cost for a procedure would be along the lines of $7,000. Is it painful? It can be done in the office under local and with local anesthesia and sometimes a mild relaxing medication through a pill. It is not painful. It's very easily tolerated. People do really well with it. As long as we have identified the reason for hair loss and that the reason isn't a treatable medical condition, then really anyone's a good candidate for hair transplant. So that means transgender women or men who have hair loss for hormonal reasons, and any male who has male pattern baldness, and many women who have thinning hair or receding hairlines are candidates. The other place we can transplant hair is to eyebrows and even mustaches. Yes, absolutely. I've had patients who wanted a widow's peak and had a widow's peak transplanted. I've had patients who had it, wore their hair very, very short, and they had an uneven hairline on the front at the forehead, and we transplanted that to make it more even. So that is an area where if you have a certain aesthetic goal, especially for transgender women who maybe have a hairline that's receded or more masculine looking, we can make their hairline look much more feminine, and that's a very, very good use of a hair transplant.